Hello everyone, welcome to Talking with Dr. Laz, your favorite health program on television, reaching you from Nigeria's capital city, Abuja. My name is Dr. Laz Eze. Recall that last week we talked about I mentioned the MakeOurHospitalWork campaign, an initiative of Talk Health Nigeria, started June 15, 2020. Of course, marked the second anniversary last Wednesday with the Make Our Hospital Work conference. It's a campaign that is very necessary because many of us are disappointed and feel that our healthcare facilities, whether it's primary health centers, general hospitals, teaching hospitals, should be functioning in optimal capacities. But not many of us know that this responsibility is not 100% that of government, because communities have roles and responsibilities that various health policies prescribe for them to play, especially in primary health care. So on the program today, I'll be having multiple guests. I have two in the studio and two will be joining via Zoom. What we'll be trying to do is, for anyone that is watching, to understand what this campaign is about and how you can start it in your community, because it's a citizen-led, community-based advocacy. And of course, a couple of persons who are actively involved are going to be sharing their experiences, the progress their communities have been able to make as a result of the push they made through this campaign. Do stay with us. We'll be right back after this break. Welcome back to Talking with Dr. Laz, your favorite health program on television. Yes, let me start from my right to introduce my guest. I have Mr. Felix Agada Ojochegbe. He's the Kogi State team lead of the Make Our HospitalWork campaign. You're welcome to the program.
My pleasure.
All right, by my left is Laz Eze. He's the communications associate with Talk Health Nigeria.
Thank you very much.
Yeah, good to have you on this side of the program.
It's a pleasure to be here, sir.
Yes, Laz is part of the production team, but is also actively involved from the onset in the Make Our HospitalWork advocacy. Also joining us via Zoom is Mr. Raphael Okereke, who is the team lead of the Advocacy Make Our HospitalWork campaign in Ebonyi State. You're welcome, Raphael.
Thank you very much.
Okay, so Raphael is a dentist and is the dental director of Rafa Dent Dental Services in Advocacy, Ebonyi State. Also with us is Damian Omogo. He is the Ebonyi State team leader of the campaign. Okay, Damian is here to join us. Okay, gentlemen, Laz, let me begin with you. The Make Our HospitalWork campaign started like a child's play during the lockdown for COVID-19, and a lot of persons, especially young people, joined the campaign across the 36 states. Over 1,000 persons have signed up so far. Can you explain what it's about?
All right. Thank you very much, Dr. Laz. The Make Our HospitalWork campaign is citizen-led, community-based, yes, where people from communities take responsibilities to make their own hospital work. Just like you said, what people often do is we allow everything for the government without taking community ownership. One of the challenges we have is people don't take responsibility for what they have. Like, the government has given us a hospital, so it is our responsibility as a community to take charge, to make the hospital effectively working. So that's just what the whole thing about the Make Our HospitalWork campaign is all about.
Okay, let me correct something.
Okay.
Yes, governments may provide a health facility, but it's not the whole responsibility of the community to make it work.
Exactly.
But the community helps, they complement. It's the responsibility of the government to make sure that these things are working. And of course, with the active participation and involvement of the community. But where communities play more role is actually in primary health care.
Okay.
In teaching hospitals and secondary health facilities, yes, they could play some roles, but their roles are, not very well defined.
Okay.
So coming to you, Felix, in Kogi State, what has it been like in the last couple of years? Last year, the Ogugu Make Our Hospital Work campaign was voted the most active community team for 2021. Another community took, outshined them this year. So kindly share your experience. What has it been in Kogi State with the Make Our Hospital Work campaign? What have the communities been able to do, especially in the area of primary health care?
Thank you so much for having me on the program, Dr. Laz. In Kogi State, it has never been a smooth sail for all of us in Kogi State, and the community has its tentacles in 3 local governments in Kogi State. But the most active, campaign has its tentacles in 3 local governments. The most active community is the Ogugu Make Our Hospital Work Committee.
Campaign, you meant, okay. So in Ogugu, what have you been able to do so far?
Well, in Ogugu, we have had series of achievements since we started on June 16th, 2020. We've been able to, we started by cleaning the hospital environment, by cleaning the wards in the hospital. Through that action, we're able to buy into the hearts of the citizens of Ogugu. We've also been able to, in conjunction with other indigenous organizations, like the Ogugu United Forum, the Ogugu Development Initiative, we've been able to reach out to sons and daughters of Ogugu who have the heart to do some things for the town. So we've been able to employ 2 health attendants for the hospital, because we discovered that in our visibility studies, the community lack adequate health workers.
Was it the campaign that hired these people, or is it the community that does that?
It is the campaign. What the campaign did was to sell it out to the community that yes, these are the things needed in the hospital. Okay. Then these organizations and some well-meaning individuals were the one who took up the zeal who took up the quest to
make those interventions.
To make those interventions.
So the campaign was more like a catalyst.
Yes, it was a catalyst.
Okay. Raphael, joining us via Zoom, is the team lead of Advocacy Make Our Hospital Work campaign, and they were voted the most active team this year. Congratulations, Raphael, on that. And kindly tell us what you've been able to do in Advocacy Make Our Hospital Work campaign.
Yeah, thank you very much, Dr. Laz. We Advocacy Make Our Hospital Work, and me being the team lead, we've been able to do a lot by the special grace of God. I think we've been able to bring the entire community, 3 communities, all the Ezes who queue into the program to make our hospital work, getting their full support. Yeah, and then other development groups and unions in Advocacy in general have also queued in, because they see the need to do so. Right now, in the hospital, we've been able to help to make sure that water reticulation is done in the entire hospital, both inside the 4 wards, the entire OPD and emergency ward.
Which hospital are you talking about?
Quarters where the doctors and other nurses stay. Water now run everywhere. Water reticulation done and dusted. There is also a ramp. Ramps have been made in the whole hospital to connect every nooks and cranny of the hospital, from one unit to the other, from one ward to the other. So,
okay, sorry, Ralph, I'm interrupting. Which hospital are you talking about?
Can easily roll to every side. It has been done. Community work has been done, whereby the town crier, the Ezes in charge, I asked the town criers to call upon the people to come and work, and that has been done. We've been able to get the kings, to get the people who have some contracts but couldn't finish it, to come and finish their work. At least some of them have gotten some laterals and finished some of the work they left uncompleted before we came in. And then we also use social media to propagate certain things, using bloggers, different aspects as much as we can to propagate the ill odds of the hospital. And then by so doing, we attracted hospital equipment worth of millions of money to the hospital, which is now on ground, and we have the invoice that contain all of them. We've made sure that every hospital equipment that comes in is being secured. So as it stands now, we don't miss or lose anything. If any health worker is collecting anything, you are coming to sign in, and whenever you can account for it. Whenever we ask of it, you should be able to tell us this is how it goes. So, and then by so doing, Advocacy Make Our Hospital Work, through the influence of Advocacy Development Forum, they formed a health committee that see that everything concerning the health and then the hospital, General Hospital Advocacy, is being attended to. They also formed work committee who help to make sure that any project they want to carry out in that hospital is done and dusted and accounted for the way it's supposed, of which me being the team lead is also part of the member, and I supervise everything they do to make sure thing is being.
Okay. All right. Thank you. I believed Ralph was talking about the Advocacy General Hospital in Ebonyi State, where all those interventions by the community, in some infrastructural, he's mentioned about water reticulation, building of ramps to enable patients on wheelchair or trolleys to be able to move around the hospital, as well as the formation of health committee and works committee by the community. Zax, the Make Our Hospital Work in Ebonyi State, there is a program on radio that we are doing, the Talk Health Nigeria radio show, that is essentially talking about what communities can do. And there's been a number of responses. But before we get into those details, I want you to describe steps that anybody that is watching that wants to facilitate the formation of this campaign in their communities. Let's note that it's not the campaign that does the jobs. The campaign acts like a catalyst to get the communities to do those things. So the campaign essentially doesn't take glories for this intervention. It's those communities that are actually taking the actions through the sensitization of the campaign. So stepwise approach for anyone that wants to be a catalyst in their communities to making their primary health facilities work.
All right. Thank you very much, Dr. Laz. So there are basically seven steps that anyone who wants to be a member of the Make Our Hospital Work campaign or have to take. And then the first thing is you have to build a team. So
is this someone that wants to be a member or someone that the steps to getting communities to act?
Yes. So there are just 7 steps, and they are very easy. Yes. First of all, you have to identify people of like minds, right? You have interest. This is what we want to make our hospital work in our community. You identify people of like minds. That's when you identify them, you come together and then you form a team of people. Then after you form a team, you identify a health facility. Now, it is that health facility that you identify that you'll be using to carry out your activities. Then the third thing is you have to take a baseline functionality assessment of that hospital. Like what do these hospitals need? What is there? Now, and what people, I know when you are hearing hospital, we talked about, what we are talking about basically is a primary healthcare center.
It can as well be general hospital.
Yeah, it can as well be general hospital. But the thing is, people, when you say hospital, the people don't really see the primary healthcare center as a hospital until you call it a primary healthcare center. So what's the third thing is the baseline functionality assessment, where you go to the hospital, you check out some of the things that are not working in this hospital, and then you take it, you write them as a list, right? You take them and then you begin to work with them. But the fourth thing is to cost it, right? Costing, you prepare a costed wish list. These are the things we have identified in the hospital, and this is how we want them. This is amount is going to cost us to get them, right? So the fifth thing is you develop an advocacy plan, right? Because the whole project, like you said, is a catalyst. The Make Our Hospital Work campaign is a catalyst. It's not something that is going to do the work by itself. It is something that will prepare people's mind to come into this. Let us do this thing so that it will be okay. So you develop an advocacy plan. Now, this advocacy plan is going to tell you who you are going to meet and where you are going to meet them. For people who are members of the community, people the community respect as well. It can be organizations within the community. So it is through this advocacy plan that we are going to really know who the people are. And then the fifth thing is you implement the activities of the project. The activities of the Make Our Hospital Work campaign. Through the advocacy plan that you've already drafted out, you begin to implement those activities. Then at the end of the day, whatever success stories we have, we celebrate them as a team. So that's how easy and simple it is to.
Well, to you it's easy, but we'll find out from the team list if it's actually been easy. But that's going to be after this break. In the second segment, we'll talk about some challenges they may have faced in the course of this campaign, perhaps other success stories, and what could be done going forward. Do stay with us. We'll be right back. Welcome back to Talking Health, Dr. Laz, your favorite health program on television. Yes, we've been talking about some success stories on the Make Our Hospital Work campaign, which is a citizen-led, community-based advocacy to ensure that our health facilities are functioning better. The National Health Act 2014, Section 2, described the health system to consist of the Federal Ministry of Health, the state and all the agencies and parastatals, the State Ministry of Health and all the agencies and parastatals, the local government health authorities. It also includes the Ward Development Committees, which in FCT, for instance, it says the Ward Health Committees. Then it also includes community health committees or community development committees, as well as village health committees. The Nigeria's health system also involves the alternative medicine people, as well as the community pharmacists, which are also referred as to patent medicine dealers and all of that. So health committees at the community or at the village level is required. And the World Health System policy of the National Primary Healthcare Development Agency defined their roles in Section 2 of that, in details, their roles and responsibilities as well as composition. So the community, if they don't play their role in primary healthcare especially, it will never function optimally, no matter what government does. So, and primary healthcare is the one that is closest to the people. And this campaign is all about, sensitizing communities, citizens volunteering to be being part of that sensitization. And it doesn't matter whether you have health background or not. Any citizen, just like my guest, I'm getting back to him, Felix Gada Ojochegbe is the Kogi State team lead of the Make Our Hospital Work campaign. You studied chemistry, right?
Yes, doctor.
Do you have any training in the health sector?
No.
Okay. So we were talking about, Zax was saying, it's very easy, it's as simple as ABC to be in this campaign and all of that. And I say, okay, I wouldn't blame him. He's in Abuja and doing more of coordination and providing technical support to the campaigns. But you, with what is happening in Kogi State, how easy has it been? What were the critical challenges? Why is it that it's just Ogugu that is active and other communities are not active? And what are those barriers and how can we fix them?
Thank you so much. It's not a rocket science. As assumed by many, trying to bring such a campaign to the people, a campaign that is not supporting the healthcare facilities financially. Since it's a community led advocacy, it's a community-led advocacy, so there is nothing that like financial support or anything from the headquarters. So it's always difficult. Myself, I studied chemistry. I had no background in the health. So what we were able to do to curb that challenge was to include health practitioners in our team. We were able to include health practitioners who were working with the Ogugu Government Cottage Hospital. We were also able to include retired health workers So by so doing, we were able to, we were also able to include the traditional rulers, the religious leaders, okay, the chief imam of the mosque, the parish priest of the Catholic Church there, and other Pentecostal pastors.
So they are all parts of the community
yes, they are all
response.
parts of the community.
That really sounds great.
Yes.
What about the diabetic center that was recently set up at the Ogugu Cottage Hospital? Could you just tell us a bit about this in a few seconds?
Yes, we are privileged to have a diabetic center in Ogugu Cottage Hospital, courtesy of one of the sons who works with the Federal Inland Revenue Services, because this project is being sponsored by the Federal Inland Revenue Services. So the campaign has been able to gain wide coverage, to see, to make the sons and daughters of the land to key into the campaign. So that's what we've been able to do, and we've not done this as a team alone. We've had other sons and daughters of the land who were willing to sell out the wish list.
Okay, they got more interested.
Yes, they got more interested.
You mentioned the wish list, perhaps the one Zach talked about.
Yes.
The wish list is when you carry out the need assessment, you list the needs.
Yes.
So you circulated it among sons and daughters of Ogugu, and many of them are now picking up items to support the community.
Yes.
All right, I'll come back to you towards the end. Raphael Kereke, are you still with us via Zoom? Yeah. Okay, so it's like we lost him. Coming back to you, Zax, you were saying it's very easy to do this campaign, and I would disagree with you on that, because as a national team lead of the campaign, I get lots of reports on barriers and how people, there is a community. One of the reports I got from the Okwosi MakeOurHospitalWork campaign team, they went to a village to carry out sensitization on why they should set up health committees. I watched the video, and they were like, are you going to be paying us sitting allowance? You know, are we going to be paying us transportation and feeding when we meet? You know, the regular things that perhaps some NGOs do in the case of it. So, and they've not set up the health committee, perhaps because they were awaiting some interventions. But at the same time, there is another committee that after so many months, they were able to set up health committee. And in fact, some days ago, Ralph was telling me that they had a town hall meeting and were able to decide to set up a health post, a primary health post to solve their needs. So coming to some of the developments in Ebonyi, what has the experience been like? We were supposed to have the state team lead, but unable to join us via Zoom. So what has it been like from the reports you've been getting from Ebonyi State and the MakeOurHospitalWork efforts?
All right. It's been, the campaign has really been producing a lot of results, right? It's really been very productive, because like most of the hospitals in the rural communities, per se, they are not really functional. But due to the activities of the MakeOurHospitalWork campaign currently going on and the radio program, like you mentioned, a lot of communities are taking actions to make their hospital work. Like you rightly said, it's not easy, because many of these people, they always demand for money. But through the sensitization and the messages they hear, they now understand that they also have a role to play as a community. So a lot of communities...
Is it all communities that are responding to the radio program? Is it in all local governments?
No.
Because you don't need to over-exaggerate the outcomes.
No, yes, it's true that it's not in all the local governments, right? But the radio programs, a lot of these communities here. For instance, the activity is not going on in my own community.
Okay,
but
so I indict you on that.
Yes. But like community called me and they talked about, they asked, how can we set up this thing? How can you help us to do?
So, Zax, you're on national TV. So why is MakeOurHospitalWork, in fact, let me not make it MakeOurHospitalWork. Why is your community not taking active steps yet? Okay. When you are there? Let me put you on the spot.
Okay. Yes, my community has been taking actions, right? Now, some of the challenges we have is, like in my community currently, there are lots of things going on. which I would not really want to say on national TV. So those are some of the bottlenecks that are really affecting us.
Okay.
Yes.
So in the next few weeks, Ntezi
yes,
community
yes,
will
in the
begin
next
to
few
take
weeks,
more actions.
yes, we will take actions, certainly.
Okay. The thing is a marathon kind of, in these efforts, because it's not something that all of us are very used to. Not so many persons know that we have policies of government that puts certain responsibilities to communities in terms of primary health care. Not many persons know that even the monies that are generated within the primary health care, should be to the knowledge of the community. We have many health centers in Nigeria that are not working. So this is not a time to start building new ones. It's a time to make the available ones work. Thank you, Zax Onwe, Communications Associate, Talk Health Nigeria.
Thank you very much, sir.
And thank you, Felix Ojechegbe, State Team Lead, Kogi MakeOurHospitalWork campaign.
Thank you so much.
And also, once again, thank Raphael Okereke, dentist, Team Lead, Advocacy MakeOurHospitalWork campaign, who joined us earlier via Zoom, but we had technical issues and it dropped there. And to you that watched us up to this point, what are you doing to make our hospital work? Take action today. My name is Dr. Laz Eze. See you same station, same time next week. Bye for now.